When talking about vaccinations, it can be really tempting to leap in with facts and figures and data and think the only reason people aren't getting vaccinated is because they're lacking in information. Actually, every day as we move through our day, we are bombarded. The only way that we can get through our day without our heads exploding is by filtering and paying attention to some things and not others. And we use some of our prior learning, some of our history, our values, our beliefs, all sorts of things to help us filter that. A really powerful one is your gut feeling. And if someone's feeling is that this is not a pleasant thing to think about, then they will filter out that information, those facts and those figures you're trying to put in there. So it's really important to slow down, focus on creating a positive gut feeling, if you like, for the situation, the conversation you're in, and then starting to explore with the person what kind of information is going to be relevant for them. When we talk about the groups of people that might not have taken up the option for vaccination yet, there's a number of different reasons why that might be so. So there's the people who are waiting to see, right? They've got quite a different reason for not having got their vaccination yet to someone who's actually really anxious about the whole thing, the vaccination or the needles. There's other people for whom it's about time and organisation and access and transport and childcare. There's another group that may have faith-based concerns about it that need to be addressed by someone they trust from within that community. There are others who their experience of the health system or the government hasn't been that positive or historically hasn't been positive, and they have a reluctance based on that. And then there's your groups that have really strong and highly developed thinking around conspiracies or the idea that COVID is all a made-up thing. So it's really important to understand, give space for that understanding before you launch in with information and facts overload.